Within clinic and surgery, physicians will utilize walking boots to add stability and protective support to patients. This tutorial will walk you through the steps of dispensing and cataloging the walking boot so we may keep track of them and make sure they are billed.
When a patient undergoes surgery, they will always be fitted and leave with a post-operative walking boot. As a rule, anyone having surgery will be sent home with a short walking boot. Now in clinic, patients will be given walking boots as well for support to a mechanical or structural problem. The general rule within the clinic is that all patients will receive a tall walking boot. These are general rules, and the physician will have the final say if they want to switch something up. To get a patient a walking boot, whether tall or short, you will need to know their shoe size. Now, the general sizing is shown here for shoe size to boot size. For the boot size small, generally any woman's foot up to size 8 will fit, as well as any male foot up to size 6. For a medium-sized boot, the range between 8 or 8.5 to 11 for a woman, and for males, 6.5 to 10. And a large boot, a woman's 11.5 and up, or a men's 10.5 and up. Again, these sizes are general. You may find one size doesn't fit for a patient, and other consideration, like leg size, must be taken into account. When you retrieve the boot for the patient, you will need to take the boot to the boot log and make sure it is properly signed out. The boot log is located in the nurse's dirty station in Centralia and in the laundry and supply room in Tumwater. It is organized by sizes, small, medium, large, and length, tall and short. You will find the section that the boot is under, for instance, the large, tall boot section, and you'll need to look at the inventory that has been checked in to match the boot. To match the boot, you will look at the plastic packing the boot is wrapped in and find the set of removable stickers on the side. There will be multiple, and one will be missing. The one that is missing is in the boot inventory sheet. You'll need to grab a sticker from the set and find the matching size and lot number in the inventory and place the sticker on the dispensed side. You will then need to write the patient's name, date, and doctor dispensing in the middle section. Make sure to take the time to inventory and check in the boots as you dispense them. This allows us to stay on top of the ordering and collections. You will then take the boot to the patient and make sure it is a proper fit. The toes should be near the edge but not overhanging, and there should never be more than an inch between the toes and the edge of the boot. Now, some foot sizes will make this impossible. You will find a foot where one size is way too small and the next size is way too big. Make an error on the side of being too big. It's way more bulky, but it will not cut off into the toes like the smaller boot would. Place the patient's foot in the boot and snugly secure the Velcro around the patient. Make sure the heel is all the way to the back. A common mistake in placing a boot on a patient is not adjusting the heel properly so that they're forward in the boot. This makes it impossible to cinch down the boot and make it snug. The idea of wearing the boot is to immobilize the foot and ankle, not to cut off the circulation. So make sure they understand that the boot needs to be snug enough so that the foot and ankle do not move at all, but not too snug so as to cut off the circulation. When you've placed the boot on the patient is then ready to leave.